So since we said about cardiac involvement, I'll just tell you, not a characteristic finding, but okay, what you do get, okay, and the only way to say it is when you do an MR. There's no other way of telling, or thinking of sarcoid. If you know a patient is a known case of sarcoidosis, yeah, and then you get this sort of pattern, okay, there's sparing of the subendocardium of variable late gadolinium enhancement and involvement of the basal heart, particularly the interventricular septum. Okay, that is seen in sarcoidosis. Also, other things have been mentioned: nodular midwall hyperintense foci and all. I'm not an expert on cardiac MRI, but this, just remember this: sparing the subendocardium and predominant involvement of the basal heart and the interventricular septum. And the characteristic pattern is a late enhancement. I got one example to show you. So here they've shown that it involves the interventricular septum there. A few other signs, okay, because you have involvement of head and neck structures also. So you have on gallium scanning what's known as the panda sign. So here you got involvement by sarcoid of the lacrimal glands and the salivary glands, your parotid there. The panda sign, the one other thing, if you see, that's your lacrimal glands and your parotid glands. This structure here is really lymphoid tissue within the nasopharynx. And this can be physiologically, it's not necessarily involved by sarcoid, but this sort of picture is what gives you your panda sign. Also in gallium scans, they've mentioned lambda sign, not a very specific sign, but here they're talking about your hilar lymph nodes along with the right paratracheal, which if you can think, you've got one hilar there, another hilar there, which is enlarged and which shows some tracer pickup. And along with that, the right paratracheal, this gives you the Greek letter lambda. Okay, and if you can imagine that. So here again, you can see definitely this involvement of the salivary glands there. And that's the nasopharyngeal tissue. Neurosarcoid, again, not a common entity, but there are certain characteristics of involvement. Okay, if you know a patient with significant leptomeningeal thickening and there is some nerve palsies, commonly facial nerve. Facial nerve is the most common nerve involved in neurosarcoid. Okay, and these nerve palsies usually show rapid onset, but will resolve with treatment. Steroid treatment gives dramatic changes in patients with neurosarcoid. The other areas of involvement include the optic nerve, optic chiasm, the hypothalamus, and because of that, you can get patients can just present with diabetes insipidus. In fact, we've seen a few patients who presented just with hyponatremia, and then they diagnosed them with diabetes insipidus. And when they did MRI, they picked up leptomeningeal thickening as well as involvement of the hypothalamus causing diabetes insipidus. These are examples where you can see these areas of meningeal enhancement in the basal cisterns as well as along the fissures and even along the ependymal, some ependymal enhancement also there. Okay, so diffuse enhancement along the meninges, along the ependyma, and along the basal cisterns there. Here you can see pretty dramatic leptomeningeal enhancement there in a case of sarcoid, and it goes all the way across down there in the coronal images. Here there is involvement of the hypothalamus, which is enlarged and also probably shows some enhancement there. Little more dramatic leptomeningeal enhancement there in the region of the foramen magnum. Here it's almost causing compression of the spinal cord there, and also in this region in the cervical cord. Skeletal sarcoid, again, not common, but from an exam point of view, it's got some classical findings. So it's good for you to remember this. The most commonly affected part are your hands. Okay, the changes are seen mainly in the middle and distal phalanges. And you have what's described as a lace-like pattern of bone destruction. You can also describe them as cystic changes with well-defined margins, okay, or some lytic bone lesions. Periosteal reaction is not always seen, but can be seen. And there's remodeling of the cortex of the phalanges. And the concave shaft of the phalanx can be changed into a tubular structure because of these changes, which I'll show you. So there you can see your lace-like pattern there. Okay, again, in one of the middle phalanges there of the middle finger, you can see some sclerosis there, but a lace-like pattern. And there's probably some sclerosis at the margins. Although we've said hands, here's an example of involvement of the phalanges of the feet. Okay, not common, but you can see there is almost, I would say, bone destruction. In some areas, you can see that lace-like involvement, but in this, okay, significant thinning out there of the bone. And in some areas, you can see some coarsening of the trabecula there, as well as cystic changes. Okay, the classical lace-like is probably seen in this one. Now, although we say much more common in the hands, you can get bones affected all over. So this was a case where it looked like metastasis because of involvement of the vertebrae. But this actually turned out after investigation to be a case of sarcoidosis, which has caused significant vertebral body involvement. Not common, but just to tell you that sarcoid can present in some pretty mysterious ways. This is one case from my hospital where we were running around in circles because for all practical purposes, the patient presented and looked on imaging like a case of lymphoma. And why we say lymphoma is you can see significant splenomegaly, multiple nodes. Okay, not all of it symmetrical. Okay, maybe some of it you can say hyla, but the nodes go all the way to the neck. They almost look like unilateral involvement on the neck and even the mediastinum, but nodes, pretty much a lot of nodes involving the mediastinum and even the paracardiac regions. You can see these areas of the tracer uptake, the FTG PET showing trace uptake in the pericardiac or the lower hilar regions, and a lot of nodes in the abdomen. But this was a case when we finally, they got a tissue biopsy and histopathology. It came out to be sarcoid. One interesting article I've taken this off an article. They've actually mentioned because it's more common in women. You do know that in sarcoid you can get testicular lesions and patients can actually have infertility. But you also have cystic adnexal lesions described in women. Okay, so these are the cystic adnexal lesions which subsequently after steroid treatment significantly decreased in size. Uncommon, rare in fact, but just remember you can get findings even in the adnexa. So to summarize, sarcoidosis is a really interesting entity. Okay, you have classical descriptions on CT and chest X-ray, but because it's got a lot of atypical presentations, sarcoidosis would come in a lot of differentials wherever. Firstly, you get lymph nodal enlargement. Secondly, lung lesions, especially where you see small nodular lesions. And thirdly, bone lesions. So just remember that. That's, I would say, would be your take-home message.